England's test and trace system was also launched today. Thousands of people have been employed as tracers. They will have the task of tracking down those who have been in contact with someone who has tested positive for the virus. Our health editor Hugh has the latest.
For millions of people, a scheme in place today might make a big difference to their lives, though they don't know it yet. Potentially they could be told they've met up with someone recently who now has the virus, and they'll have to self-isolate for 2 weeks, even if they're not ill. They could find out through an email or text or phone call, and then be asked to get in touch with the NHS.
From now on, if you are told you have been exposed to an infected person, you must self-isolate for 14 days.
They'll hear that from contact tracers. 25,000 of them will do the job in England, and as their task began, they received a video message from the Health Secretary, Matt Hancock.
We can't do any of this without you, and working together we're part of one big team delivering the service. In the days and weeks ahead, the advice that you give and the support that you offer will make a difference to the lives of everybody who you speak to.
New contact tracers have been signed up and trained, and they'll work with health professionals, some of whom already have experience talking to patients with infectious diseases and then trying to find out who they may recently have met up with.
We're very used to going through a detailed account of your movements over the last 7-9 days. We use diaries, we use cues, days of the week, what the weather was like to help people remember. We're very used to doing that and we'll continue to do that. So I think this is doable.
But one contact tracer who wanted to remain anonymous told us she couldn't log on to the system and so couldn't start today.
I was told that system was not even yet ready to start. The guy told me that so far they had a start date for next Monday, but not before that. At that moment, I already thought, well, that is quite disappointing.
Other contact tracers also struggled to log in this morning. The Department of Health acknowledged there had been problems, but said these were being rapidly resolved. The system's been formally launched today, but it's not yet clear how many people have so far been contacted. Officials have acknowledged it may take a week or two for the system to be working at its full capacity. Hugh, BBC News.
Our medical correspondent Fergus Walsh is with me now. So restrictions are being eased again, but there is clearly nervousness about what could happen next.
There is, Sophie, and Sir Patrick Vallance, the Chief Scientific Advisor, said that we are in a very fragile state and there's very little room for manoeuvre. We have to be cautious. So a lot of nervousness there. And it's all down to the R number, this rate of infection. This is the average number of people that each infected person will pass the virus on to. Now, with coronavirus, with no social distancing measures, that number is around 3. You quickly lead to a doubling and a redoubling of cases every few days. So the lockdown is about bringing down that R to below 1. And the latest estimate has been over the past 2 months, we've now brought it down to somewhere between 0.7 and 0.9. Now that is perilously close to getting above 1 when the outbreak could get out of control again. And it's estimated that around 93 in 100 people in England have not yet had COVID-19, and around 500 people a day are still being admitted to hospital in England alone, well down on the more than 3,000 a day in early April, but the threat is still there.
Fergus, thank you. And if you want more information on the measures announced today and the tracing systems that have been put in place, you can find the details at bbc.co.uk/news/coronavirus and then click on the links.